Good morning, everybody, and welcome to the S&K Educational Compliance webinar. I know we've been very busy, and due to the fact that legislation keeps changing, we invited our friend from Cal OSHA to speak again. A lot of you out there actually pinged me and said, hey, what is all this new stuff that's happening? So it actually kicked it into high gear. And we put together this webinar. I know you have a lot of other webinars to choose from, but thank you so much for attending today. Again, we're going to be going over the new COVID-19 prevention emergency standards. And I wanted to welcome, we are now friends now, Juan. Just want to let you know that, okay? You're part of the S&K crew here. So Juan Calderon is the district manager of the Cal OSHA Enforcement Outreach Coordination Program Unit. Prior to his current assignment, he was district manager for the San Francisco, Fremont, San Jose district offices of enforcement, and he was approximately 30 years, just only 30 years, right, Juan?
In a little bit more now, but anyway, yeah.
In health, which 20 years have been with Cal OSHA. Juan, you guys have been busy over there at Cal OSHA.
Yes.
Yes, and I know that things were signed recently. You just went through your specific training. So ladies and gentlemen, I just want to let you know that this is hot off the press. A lot of this information is kind of, would you say, piggybacking off of what you already have in place, correct, Juan?
That's
so
correct.
We're just expanding it a little bit, and really this webinar is for all of you to ask some questions, so that way you can be in compliance as well too. So to go over the new emergency standard, we're really going to look at 3205, which is the COVID-19 prevention. 32051, talking about infections and outbreaks. And then 3205.2, hopefully you will never have to deal with this, but looking at what's considered a major COVID outbreak right now. So I know that here in Los Angeles County, it's pretty strict in regards to going out to eat and restricting a lot of things, but we are seeing from our side an increase in the number of claims, unfortunately. So, you know, I understand the timing of all this and why it's needed as well too. So Juan, you can go ahead. I will be your slide presenter and let me know what next slide you want to go on to. Well, we'll start off with the 3205.
Okay, well, good morning, and thank you for having me here again this morning. Okay, so let's start off right with the beginning. Is all of you know, since March, not only has California, but the whole world has been battling COVID-19, and for the past 6 months or more, here in California, the Division of Occupational Safety and Health has been addressing COVID-19 as a workplace health hazard. Okay. During the interim, the division, again, following the guidelines from the Department of Public Health for the state of California and the Center for Disease Control, and through the Office of the Governor, the Division of Occupational Safety and Health developed procedures for the prevention of COVID-19 in California's workplaces. The Division of Occupational Safety and Health has primarily 2 standards that were being used for all work being done in the hospitals, in health environments. The air transmissible disease standard is the standard enforceable, but for the rest of the general industry in California, the enforcement standard is the Injury and Illness Prevention Program. Okay, you can basically compare our Injury and Illness Prevention Program similar to the federal government's General Duty Clause 5A. So basically, prior to November 30th, the Division of Occupational Safety and Health used the Injury and Illness Prevention Program that you as an employer are required to have to enforce the spread of COVID-19 in California workplaces. On November 19th, the California Standards Board held an emergency hearing to present the emergency standard, okay? The emergency temporary standard for the prevention of COVID-19 that was heard and approved on November the 19th. And the standard was adopted that night, and the standard was submitted to the Office of the Secretary of State, and it was adopted and finalized and given an effective date. So we have a total of 5 standards that make up the regulation for the prevention of COVID-19 in California workplaces. Today, we'll be talking about 3 of them as it was introduced, 3205, 3205.1, and 3205.2. 3 and 4, basically, 3 deals with housing, where employers provide housing, and 4 deals with the transportation of workers. So those we will not be addressing today. If you would like us to do a presentation on those, just please contact Tony and we can do that. Okay, so 3505. Well, what is going to require you? Well, it's going to require you to have your written program. Now, all of you should already have a written program to address COVID-19 in your workplace that was part of your injury and illness prevention program. Now, the new standard now requires you to have a written program specifically addressing COVID-19, okay? And the program requires you to have all of these elements which are contained right here. Communication, identification, evaluation of hazards, cases in the workplace, record keeping, exclusion of workers or cases, employees in return to work, correction of the hazards, physical distancing, face covering, engineering controls, PPE, training, and report keeping. Well, what's new in here now? Now we have this COVID-19 cases in the workplace. We'll be talking about the definition of what that is. We'll be talking about the exclusion of COVID-19 cases in your workplaces, and the return to workers to work. That is something we're going to be addressing in the new standard. Next, please. Okay. Scope and coverage. It applies to all workplaces in California, okay, with the exception of those which are covered under the aerosol transmissible disease regulation. Okay. Next slide. Okay, again, it covers those employees which are working split locations. If they're doing teleworking at home, it does not cover them for there, but when they return to the workplace, it covers them. So it's very important for you to recognize this when the standard is enforceable by the division, okay? Okay, and again, as I stated, if you go back one, okay?
Oh, sure.
Okay. Okay, again, if your facility is covered under the aerosol transmissible disease standard, well, many areas of those facilities basically do not deal with patients which are ill. So all those areas there fall under the general standard. Next slide. Okay, the standard is effective now. It became effective the date that was signed and published by the Office of Administrative Law, November the 30th of the present year. Next. Okay, now the next slides basically deal with definitions. It is very important for you to fully understand the definitions because these are the ones that are basically are going to be the areas where the Division of Occupational Safety and Health is we're out there doing inspections. We're going to be looking at if you fully understand the standard and its meaning. So again, COVID-19 means, again, the disease, okay? It doesn't mean anything else, okay? The next one is, what is a COVID case? Well, a COVID case relates to when a person has had a test done and he comes back positive, okay? That is very important, okay? Or, again, he's subject to a order given by a local public health official or agency. And again, the subject died from COVID-related symptoms, and he was diagnosed as that is the cause of death. Okay. Next. Okay, and this is very important. Okay, and now this definition is changing based upon the information coming from the Center for Disease Control and coming from our California Department of Public Health. But presently, this is the definition of a person no longer being a COVID-19 case. Okay, and again, the most important thing is that for those cases where you had a COVID-19 case and the worker was excluded from the workplace, before he can return to work, it has to be done through a medical professional. Okay, next slide. Okay, again, COVID exposure. And again, it means being within 6 feet of a COVID-19 case. So in other words, you have a workplace, you have an employee that is positive for COVID-19, and he is working in your facility, and now you have workers exposed to him because they are within 6 feet of him, okay? So that is exposure, okay? And again, COVID-19 hazard means exposure to potentially infectious material. And again, now, as we discussed in the previous webinar, again, the virus, once expelled from our body system, will settle to surfaces. So again, when we look at our workplaces, we need to look at those areas where COVID-19 cases have been working in and about that location where they may have contaminated the surfaces. Next one. Okay. Again, the symptoms, again, the definition is the same. We've stated before. Again, that means a fever of 100.4 degrees Fahrenheit or higher. Again, the workers experiencing body chills, cough, shortness of breath, difficulty breathing, fatigue, muscles, body aches. Okay, now, the person is defined to be a COVID case once the test indicates that he is positive, okay? And again, the definition of a COVID test, again, is based upon our definition of the FDA. Next. Next slide. Okay. Okay. So go back one. Go back one, Tony. Okay. Okay. Exposed workplace. Okay.
Uh-oh, are they seeing exposed workplace? Let me go to back.
Go to the next slide. Next slide. Okay, exposed, okay, means any work location, working area or common area at work used to access by a COVID-19 case. Okay, so again, any area where this worker may be walking about, it is going to be considered as an exposed workplace. So as you are doing your hazard assessments of your facility or your work site, you want to consider where people are going to be walking. Okay, and as you identify or become knowledgeable that a worker is now a COVID-19 case, now you need to look at the areas where he has had access to, and where, because now you're going to have to look at the procedures for disinfecting those locations where he may have been, potentially breathing and dropping the virus into areas. Okay, and again, the January 1, the exposed workplace also includes but not limits to the worksite COVID-19 and is defined in labor code. As you can see down here, here's the definition in the labor code about a work site. It says building, store, facility, agriculture, field, other locations where worker works during infectious period. So that's the definition of a workplace. Okay, next. Next slide, please. Okay, again, we go back to the requirement for face coverings. Employees are required to wear face coverings in the work area, in areas where employees may be outside the building where they may congregate. Okay, and again, high risk exposure periods means the following time period for a person who developed COVID-19 symptoms. Okay, this is again based upon the current science. From the Center for Disease Control. Okay, 2 days before they developed symptoms until 10 days after the symptoms first appeared. 24 hours passed without no fever, without the use of fever reducing medications, and symptoms have improved. Okay, so that's the definition for the exposure period. And then for persons who tested positive who never developed symptoms, again, as you'll see, is quite similar from 2 days before until 10 days after the specimen for the first positive test, COVID-19 was collected. Okay, so they're very, very similar. Okay, again, you're going to have your written COVID-19 program, right? Well, as you do your hazard assessment, you want to follow the hierarchy of controls, because some of the controls that you're going to have to consider for it are going to be engineering controls. So again, you want to look at can we eliminate the sources of COVID-19, the virus? What can we do for substitution in the workplace? Can we utilize engineering controls? Now, you're going to be seeing where the standard is going to require the use of increased air into the work area, the utilization of filtration of air, utilizing HEPA filtration. And again, the administrative controls is our worker management of workers, the use of the good hygiene, the use of face masks, the distancing, okay? And then the ultimate would be the utilization of the NIOSH approved respirators, at minimum the N95s, or if required, then your half face with HEPA filters or powered air purifying respirators based upon the conditions in the workplace. Next. Okay. So what are the main requirements of the emergency temporary standard? Okay. Well, again, we said that you have to develop the written COVID-19 prevention program. Now, all of you should already have this written program, okay? Because back when we addressed COVID-19 as a health hazard back in March, and we notified California's workplaces of the enforcement of COVID-19 as a health hazard under the Injury and Prevention Program, we told you you had to develop a COVID-19 program. So there is nothing new really. All you have to do now is formalize your program to ensure that you cover all the elements as required of it. Communication to employees about COVID-19 prevention. Those are going to be the procedures you're going to be utilizing in your place. The procedures you're going to use to identify, evaluate, and correct COVID-19 hazards. Physical distancing of at least 6 feet, unless it's not possible. The use of face coverings, that's going to be mandatory. The use of injury controls, we talked about that. And again, provide training to your workers in the language that they understand. Next. Next slide, please. Okay. And again, we've talked about this already. You know, you want to train your workers on the COVID-19, the hazard, and all the procedures you're going to be utilizing in your workplace. And again, it has to be done in the language that they understand. So if you have workers that are not fluent in English, you may utilize an employee that is fluent in both languages to communicate your COVID-19 program to your workers. Okay. Next slide. Okay. Again, very, very important that you go back and you retrain your workers on understanding the symptoms of COVID-19. Okay. And for them to understand that the prevention of spreading the COVID-19 by physical distancing, understanding the self-screening at home, including taking their temperatures or understanding the symptoms of their body. Again, always try to use the guidelines provided from the Center for Disease Control. And again, it's very important for you to communicate to your worker. Do not come to work if you have symptoms of COVID-19. Okay, very, very important. Okay, you want to tell your workers is get tested. Okay, again, you want to cover where you work with your employees. Again, the requirement for wearing now, once they're out of their home, face coverings all the time. You're going to require it at your workplace. It's going to be an element of your regulations for your work. Employees shall wear face covering because that is contained in the standard. Okay, and again, you want to cover part of it is sanitation of it. And again, you want to tell your employees is the importance of the mask is to retain the virus within the mask and keeping it from spreading out into the work environment. Okay, next slide. Next slide. Next slide, Tony. Okay, again, you want to cover with your employees the importance of good sanitation. Wash their hands with soap and water. Make sure they're using disposable paper towels. They are not sharing towels. Again, they may utilize sanitizing products, hand sanitizing products, which are approved for application to the hands to ensure that they don't suffer any dermal conditions if they utilize disinfecting products that are for surfaces. Okay, next slide. Next slide, okay. And again, we talked about this again, the guidance, orders, requirements addressing illness in the workplace. Again, encourage the sick workers to stay home. One of the problems with it has been that workers were basically coming to work even though they were ill. Why? Loss of income. Okay, and we're going to be talking what the standard now states as to what's going to happen when we start using inclusion or exclusion of the worker from the workplace. Okay, so again, if you have a sick worker, you want to send them home. And again, and at this point here, you're going to have to start doing a complete assessment of his work area and other workers that may be potentially exposed to a COVID case. Okay. Next slide. Next slide.
It takes a little bit of time, Juan.
Oh, okay, okay, okay. And again, you, the employer, again, as you're doing your hazard assessment, you want to look to see if it's feasible for your employees to do telework from home. Okay, so again, by doing telework at home, the employees are earning wages, and you have a more productive uh, uh, workers, providing you a final product. Okay, and again, you want to advise workers, please do not travel when it's not necessary. Okay, and again, you want to tell them that when they're out of their homes, to practice physical distancing and all the time. Okay, and again, you want to make sure that they are wearing their face coverings when they're outside of their home. Okay. Okay, and if workers show up to your workplace and they don't have any face covering, uh, you will be required to provide the worker a face covering that free of charge. Okay, and again, you want to train workers to not share personal items in the workplace. Okay, sharing the you don't want to have any communal dishes and things like that in the kitchen at work. Okay. And again, you want to establish the procedures for routinely cleaning, disinfecting commonly touched objects. Well, the standard now is going to be addressing the requirements for basically sanitation of surfaces and work areas where a COVID-19 case may have been working at. Okay, so very important. Okay. You're going to ensure that employees are well trained in the use of the disinfectants in accordance with the global harmonization standard, or HACCP. Okay. Okay. You want to protect your workers from public contact as much as possible if you are doing service related work. So it's very important, again, face mask, the use of barriers between them and the public. Okay, so it's going to be all part of your workplace assessment as to how you're going to be protecting your workers. The next one. Okay, again, the requirements for record keeping. Again, we addressed this in the previous session when we're talking about record keeping under the Engineers Prevention Program. Again, now you're going to have to record and report to the division, and we're going to be addressing your requirement to report to the local health departments cases of COVID-19. Okay. So again, this here basically is the information you have to comply with for your OSHA 300 log. Okay, so again, you're going to be reporting cases involving any COVID-19 death, cases involving, again, it has to be a COVID-19 case, okay, days away from work. Okay, again, for COVID-19, we don't have restricted work transfer to other jobs, okay? So basically, it's going to be death, days away from work. Okay. Next slide, please. Okay. Okay. So what should you do as an employer with a COVID-19 case? Well, you want to keep records and report the need. Determine exposed employees. Again, we go back to our definition of a workplace. And now I have a COVID-19 case. Who has this worker worked with? Where has he worked at? What areas? What common areas has he utilized? Because now those are going to be considered to be high hazard exposure areas, okay? I need to notify my employees of the COVID-19 case, okay? I'm going to need to provide testing and benefit information to my employees and to my affected employee, okay? Okay, and again, keep employees who have COVID-19 or have been exposed to out of the workplace, okay? until they can safely return. And again, that's going to be based upon now basically a physician saying that the person is no longer a COVID-19 case, okay? And again, I want to review my COVID-19 prevention program and correct the hazards. I may have to amend my COVID-19 program to be able to address any major incidents of COVID-19. Okay. Next slide. Okay. So this is new. Okay. Multiple COVID-19 infections. Okay. This section applies to a place of employment covered by Section 3205, right? COVID prevention. It has been identified by a local health department as a location of a COVID-19 outbreak, or where there are 3 or more COVID-19 cases in an exposed workplace within a 14-day period. What does this mean to you, the employer? Well, you are the first one that's going to know whether you have more than one COVID-19 case. Okay, so the minute that you know that you have 3 or more workers who are COVID-19 positive, this standard is going to apply. Okay, okay, and this standard is going to be enforceable until you have no new COVID-19 cases in your workplace for a period of 14 days. Next slide. Okay. Again, we talked about the exposed workplace. I mean, we defined that earlier. Remember, working areas, common hallways, bathrooms, you name it is going to be there if the COVID-19 walks in around those areas. Okay. Next slide. So this is new. Okay. Now, you, the employer, are going to be required to start doing testing. Testing for all employees at the exposed workplace. Testing provided no cost to employees during employees' working hours. A specific testing regimen is described in the regulation. So again, this is very important because now, you know, you're looking at several things. I mean, the economic impact of the cost of doing testing. So can I utilize the health insurance that I provide my employees for them to go do a COVID test? Well, all the insurances have to pay for the COVID test, okay? You should know that. Okay, you can utilize the public health service programs, which are being provided throughout the state of California for free testing of COVID. So you, the employer, you're going to have to kind of, you know, look at how can I meet this requirement, okay? But what is very important is that you have to tell the employee that when he goes to do the test, that he's going to be paid for the time while he's doing this. Okay, it's basically work time. Okay. Next slide. Okay. So again, this slide basically here covers when the testing is required, and again the employer shall provide COVID-19 testing to all employees at the exposed workplace, okay? Except for employees who were not present during the period of an outbreak. That means if you have employees working at home, it doesn't apply to them, okay? Okay, okay, okay. Or for those identified by local health department of the relevant 14-day period, okay? So that's important, okay? And then again, it says COVID-19 testing shall consist of the following: Immediately upon being covered by this section, all employees in the exposed workplace shall be tested and then tested again 1 week later. Okay, negative COVID-19 test results of employees with COVID-19 exposure shall not impact the duration of any quarantine period required by orders or orders issued by the local health department. So very important is that you should know that your local public health agencies actually may put more stringent requirements for you to quarantine employees, okay? And then it says after the first 2 COVID-19 tests required by subsection B2A, employers shall provide continuous COVID-19 testing of employees who remain at the workplace at least once per week or more frequently if recommended by a local health department. Okay, so and then employers shall provide identical testing when deemed necessary by the division. So again, the testing requirements are quite extensive, and so as you look at the number of incidents of COVID-19 in your workplace, again, this is now where I have more than 3 employees in my workplace with that have been deemed to be positive with COVID-19, that this standard goes into effect. Next slide.
Juan, I just have a question. So this, when it talks about exposed workplace, since we have 3 or more, then we're not using the 6 feet 15-minute rule, right? Since it's considered now an outbreak, correct? We're really looking at the exposed workplace and looking at bathrooms, walkways, hallways, those types of things.
Well,
So
you're looking at everything already.
right.
Okay. At this point here, you know, we're going to be, and we'll talk a little bit more, you know, as we go to the major outbreaks, you know. But at this point here, you're the employer. Once you have 3 cases or more, you know, you're going to have to start doing more in the workplace to eliminate the source of the or the vector of the infections there. And again, you go back to the first thing you're going to do. You're going to go back to training the workers. You know, you're going to go back. You got to cover the policies. You got to, you know, start asking workers, look, have you been traveling out of the area and everything else? See, because where am I getting exposed to COVID-19? 99% of the exposures are not occurring in the workplace. They're occurring outside of the workplace. And then a worker comes to the workplace that's already a COVID-19 case. He's not symptomatic, but he is now a carrier. He's a carrier, and so that's the issue, right? So again, as we look at the slide here, we start looking at the new elements of the standard. We start looking at the exclusion of COVID-19 cases, okay? So the employer shall ensure COVID-19 cases and employees who had COVID-19 exposure are excluded from the workplace in accordance with subsection, okay, with the previous, with the standard. So now you have the worker that's positive, but now you have to exclude those workers that work in and about him who were exposed to him. Okay, so that is a brand new, and we're going to be looking at the requirements now, where you are now going to have to ensure that these workers know that they will be paid their wages during this period of exclusion. Okay, and again, we go back to the requirement for investigation of the workplace COVID-19 cases. So as these cases pop up in your workplace, well, you are going to have to start really trying to identify the source of the infections. I mean, and so this is where you have to really do a thorough hazard assessment of the workplace, and we'll be looking later on in the next standard where we really are going to have to establish procedures for complete disinfection of the surfaces in the workplace or the work areas. Okay, next slide.
Okay, sorry.
Okay. Again, now at this point here, you have a new element that you have to comply with, okay? So now the employer shall contact the local health department immediately, but no longer than 48 hours after the employer knows or with diligent inquiry should have known of 3 or more COVID-19 cases for guidance, okay? So now this is brand new. Not only are you reporting that to the Division of Occupational Safety and Health, but now you are reporting it to the county. So now that means that the local county health inspectors may, in fact, may be visiting your workplace to assess the hazard. Okay, okay, and you have to provide all the information and not redact it regarding the COVID-19 cases. Okay, all the information on the employee. Okay. And then also it had a date there in January of next year, also when you have to comply with it, okay? So we dealt with 3 or more cases, but now we go to 3205.2, major COVID-19 outbreaks. And this is the important thing. This now, not only have you been dealing with trying to control COVID-19 once you had 3 or more workers on it, but now if you have 20 or more COVID-19 cases, okay, the section shall apply until there are no new COVID-19 cases detected in the workplace for 14 days. And what's going to happen at this point here? At this point here, if you get to this level here, well, not only is the health department going to be there at your workplace, so is the Division of Occupational Safety and Health. We're going to be there looking at your workplace. We're going to be looking at your written COVID-19 prevention program. We're going to be looking at what you've done relative to training of the workers. It should all be documented, the training you've provided the workers. And again, we're going to be looking at whether you've implemented an effective program for disinfecting all common areas, all work surfaces that can be now considered to be high hazard areas. So again, the 20 employees or more, it is really going to almost bring your business to a stop pursuant to Assembly Bill 685. The division has the authority to basically shut down your workplace or shut down areas where we may identify to be the area of the 20 or more cases, okay? And again, the requirement for testing that was addressed in the previous standard, okay? Employees shall provide twice a week COVID-19 testing more frequently if recommended by the local health department. Now, that's for the workers which are working, okay? Next one. Okay, exclusion. Again, the employers shall ensure that COVID-19 cases and employees with COVID-19 exposure are excluded from the workplace in accordance with section, okay, with the main standard, okay. So that means that they're not working, they're at home, they're in quarantine, okay. And again, you're going to be investigating again the sources of the COVID-19 cases. You're going to have to interview employees telephonically. You know, you don't want to do them face to face. So you want to do telephonic interviews with your employees, trying to get as much information from them. And as you would go to identify the COVID-19 case. And the reason for the investigation of it is going to be because one of the things is you know, under Senate Bill 1159, all COVID-19 cases are deemed to be work-related until investigation will show that the incident was not work-related, okay? But when you're at 20 cases or more, it's going to be a work-related exposure at that point, okay? Next slide. Again, we go back to the COVID-19 hazard correction. Again, we're addressing the workplace, the work areas where workers are working that need to be, you know, looked at as part of your hazard assessment for reducing the spread of the disease. And again, here we start looking at the utilization of engineering controls to move the air in the workplace. So we're looking at ways of bringing in forced air into the work areas. So we're looking at having your HVAC person looking at how he can reduce the recirculation of air and increase new air into the work area. So those are things that are part of engineering controls. And again, we look at the use of portable negative air filtration machines with HEPA filters to filter the air in the work area, okay? So some of the things that you are required to do when you have 20 cases or more. Next slide. Again, back to notification to the local health department, okay? So you're required to notify the local county department with 20 cases or more. And that is the 3 standards of the regulation that address COVID-19 in the workplace today, which are enforceable. Okay, next slide. Okay. Tony, there's one slide missing. You took it out.
Uh-oh, which one was it?
The one that covered the period of the standard.
You have it memorized, Juan.
Okay. The standard is effective to October 1st, 2021. Okay. So for the next year, the standard is enforced. Now, what you should know is that there's going to be a hearing held by the Division of Occupational Safety and Health and the Cal OSHA Advisory Board on the standard. I'll send the information to Tony and she can send it to you folks. It's if you're able to log on to the advisory committee meeting, it would be, you know, of good interest to see what's being said by your representatives before the Cal OSHA Advisory Committee. Because again, we're dealing with a temporary standard right now that's enforceable through October of next year. The question is whether the standard may be amended to meet future needs of our workplaces in California to address any other significant communicable diseases similar to COVID-19 that may arise in the future, whether the standard would be renamed and made a permanent standard that is some things that are being talked about in the worker representative community. So you may want to consider attending that. Okay, Cal OSHA has an extensive material available online. All you have to do is go to your browser. You can put just Cal OSHA and then hit your browser, and then just use the internal browsers there to for COVID-19, and it'll take you to a complete library of materials that we have here. Okay. We also have a Cal OSHA Training and Academy. You'll see it down here on the bottom. It has an excellent 6 modules on COVID-19. We also have, for those of you that do not have your model, your COVID-19 prevention program, we have a model program that you can download. It's in a PDF format. You can copy it to a Word program, and then you can amend it to meet your company needs. So it's available, and I believe that Tony's providing all of you the links to it so you can download the complete program. Next slide. Again, this is the certificate that's awarded to attendees that participate at the Cal OSHA Training Academy program on COVID-19. And that academy is being expanded to basically in 2021. We're going to add other courses that are needed in the workplace.
Fantastic. All right, Juan.
Okay, so I'm open for your questions.
Okay. Hopefully we don't have, oh boy, let's see here. Okay. The first question is, if an employee dies when the person no longer has COVID-19, does that death need to be reported to Cal OSHA?
Okay. If the worker died from COVID-19, okay, it's a COVID-19 case, okay? Well, you're going to do 2 things. Number one, it's you want to notify the division that an employee died from COVID-19. Okay. Now, at that time, there, again, you should start investigating. I mean, was he your first case of COVID-19, and you have no other cases in the workplace? Well, it is very important that when you notify the division, you state that you are reporting the death of an employee from COVID-19. And then you're going to provide them the information on the name of the worker and everything else, as much, and then what you're going to say, it is, we have no other cases here in the workplace, and we're investigating to determine if it is a work-related exposure, because you may actually learn that, well, that Juan went to Las Vegas over a couple of weekends ago, came home and everything else, came to work and everything else, and then he became ill and called in sick, and the next thing is he succumbed to COVID. Now, so but you have no other cases in the workplace, and so those are the things you want to do, because if the case, if you learn it through your investigation, it is not work related, well, the division, and you have no other cases of COVID-19, the division would may indicate that the exposure was not work related and will not investigate it. But if you have more cases in the workplace, which you are now going to be, if you have 3 cases, you're going to have to report to the division, right? So that's and you're going to have to report to the Department of Public Health 3 cases or more, right? So hopefully I answered your question.
Okay, next question. We got a lot, Juan. Here we go.
Okay.
Do we use the high exposure period or the testing date for the 14-day window to determine if there is an outbreak?
Okay. Ooh, okay. Okay. Well, you have an outbreak when you have 3 cases or more. Okay. So it's the minute that you start having a COVID, if you have a COVID case, okay, you have a worker that tested positive. Okay. So now, relative to the prevention of COVID-19 in your workplace, you're going to start looking at the areas where he works, areas that he had access to, and everything else, for you to start looking at disinfecting all those surfaces and looking at the workers that may have been potentially exposed to my COVID-19 case. Okay. So that's the first thing is I need to notify all my employees potentially exposed of my COVID-19 case. Okay, so it's no, I'm not going to be waiting 14 days. No. Okay.
So for example, let's say that I have, someone who tested positive like on December the 1st.
Okay.
And I have someone who, because it's really we're counting, right, in regards to determining outbreak. Then I have somebody who tested positive on December 4th, and then I have someone who tested positive on December 9th. I think the question is,
Okay, I understand it now. Okay, so
yeah,
you
as far as the
cases in
calendar,
14 days.
yeah,
Yeah. Yeah, if you get 3 cases in 14 days, then you're going to be under the jurisdiction of 3205.1. Okay, where now you have to start complying with all of that, start doing worker exclusion and everything else.
got it. Okay.
Yeah.
We have a question here. 3 days with no symptoms. This last slide seems like a conflict with Cal OSHA regs, which say 24 hours. Is that true?
Okay. That is based upon the recommendations from the Department of Public Health and CDC.
So use the
You do what the standard says. The standard says, it says three days of here. Let me look at the standard right here.
Now, while you're looking at that, I know that Anna, you said, do you have OSHA training for employees in Spanish? And Anna, the question is yes. I've seen it throughout, and I can actually send you the link to that as well too.
We can do it in Spanish also.
Yeah. Also too, now I see a lot of people here have questions in regards to pay. So
Yeah.
that is $100 million question. That's where you're going to have to run that by your labor. If people
Well, here, okay, let's go here.
RA, that is a big question. So are you on the hook for that? What would you code it in your payroll? Those are some questions that's probably not in Juan's jurisdiction, but in regards to, that'd be more of a labor law question as well.
Okay, can I answer that a little bit? That question was addressed during our training.
Why don't you go over the first question that they talked about first in regards to the 2 days or the 48 hours?
Well, okay, here. I'm trying to find it in the standard right here. The high risk employer period means following period. Okay. So say for persons who have developed, okay. So for persons who have developed 2 days before, and then prepare 24 hours before passed with no fever. Okay, so it says 24 hours have passed with no fever without the use of fever reducing medications. Okay, that's what we say. Okay, 24 hours of being free, but we still look at the number of days away from work as still being 10 days.
Correct.
So maybe I didn't understand the question.
Okay. Well, I'll send you all these afterwards and we can
Okay,
knock them out together. How about
okay,
that?
that's good.
Next question here is, if it is confirmed that all 3 cases were contracted outside the workplace, then are those cases reportable to Cal OSHA and LA County?
Okay. So, okay. The minute that Juan walks into my workplace
Mm-hmm.
and he ends up being sick, okay, my workplace is now basically has become an exposed workplace,
It's
okay.
an outbreak, right?
Okay, so the big concern with COVID-19 is that, again, we do not know where one is being exposed to.
Correct.
What the standard is trying to address is the reducing the incidence of COVID-19 in our workplaces, because, again, the minute that the employer knows that a worker is ill, the employer should tell the worker, get tested, okay? Now, or if he has, he wants to tell his workers to get tested if he has one COVID-19 case, especially if they work in and about him, right? Because the earlier that we know of the potential exposure, the earlier that we can take a proactive approach towards the treatment of COVID-19. And the aim of the standard is basically is to, if you, the employer, become knowledgeable of a COVID-19 case in your workplace, you need to basically, at that minute, right away, remove that worker from your workplace and then start looking at those workers that he may have exposed to the virus. And then at that moment there, you're going to communicate to them. You want them to get tested, and then under the new standard, it says, look, we'll pay for the test, and we'll pay it on your time. And because what you want to do is you want to limit the number of cases in the workplace, and
Right.
and
So Juan, I'll kind of talk about like on the workers' comp side. So for SB 1159, you have to report all COVID cases, whether they're work-related or they're not.
that is
If
correct.
or and you have less than 100 employees, you fit the criteria for outbreak, they all get workers' comp.
Yeah.
Unless
Well,
they're from home, right? So what I always tell people is that you really need to watch the numbers. You literally have to have a calendar, hopefully behind your door, and you have to have little dots that say COVID, and you need to watch the numbers. You need to look at the criteria. Cal OSHA is 3, Cal OSHA is 20 to fit in the definition of outbreak, right?
That's
Health
correct.
department, they have different criteria. Workers' comp, they have different criteria as well too. So I'm going to I have a long laundry list here of questions for you, Juan. What I will do is I'll send these over to you and we'll answer these together. But one of the things that I wanted to kind of go over quickly for all of you here today is, one, have an established relationship with a clinic that is able to do COVID testing for you. There are going to be positive cases. You may not fit the definition of outbreak, hopefully, but if you do have exposed employees, you're going to have to let them know and pay for those tests. Also, to make sure, I'm going to be emailing you all a copy of the model coronavirus prevention program. If you don't have your IPP already updated, use this. Train, 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 and train some more, and document this training and put it in your COVID-19 binder, okay? Hopefully you have that. Hopefully you have someone who is a designated COVID-19 officer. This is like a full-time job, right, Juan? So who is going to be doing the intake? Who is going to be doing the documentation? Who is going to be manning that calendar to say, okay, do we have 3? Do we have 4? Do we have 20? And what are the steps as well too? Response time is critical as well too. And in regards to the pay, Juan, if you could talk to us a little bit about the pay that you mentioned. I know it mentions, we have a lot of HR professionals, safety managers, and owners on the call here today. But can you give us some guidance on the pay? Let's say if people have used up their FFCRA and they've used up some of the benefits or pay time off already, what was the guidance that you got from the department?
Okay, well, under the standard, the minute that workers are into exclusion, their wages are protected and their benefits are protected, okay? That's under current law right now, okay? Now, the division, if the division becomes knowledgeable during the course of an investigation that employees have been excluded because of COVID-19 and they are not being paid their wages, the division can in fact issue a citation to the employer under our order. But what we're going to be doing is we're going to be doing the referrals to the California Labor Commissioner, who would initiate an investigation not only of maybe one incident, but now we're going to be looking at all workers that have been are in inclusion in your exclusion program, and see whether you pay them or not, and then they're going to be enforcing the California Labor Code.
Oh boy. Okay. Well, we don't want two things to be exposed. Okay. So, all right. So, I think we all have some homework here then in regards to making sure we update, have what's required. We now know the definitions as well too. We're familiar in regards to the definition of outbreak and major outbreak. I don't think any organization wants outbreak next to their company name, right, Juan? So really the big push here today is prevent, prevent, prevent. If you do have a case, see what the hazard is, disinfect, sanitize, do the proper notifications. Thank you so much for being on today, Juan. I will download all the questions that we got, and I will try to respond back to all of you as soon as possible. But Juan, thank you so much for coming on today and going over the new emergency temporary standards as well too, and also to not to jump ahead, but wanted to actually tell you all to write this down on your calendar. I've already talked to Richard by popular demand. We'll be having him for our annual labor law update. I call the Guide to Surviving in California. Juan, you might be a part of this as well too. There's new regulations, new standards, new updates as well too. So I wanted to personally thank you so much for helping us. Please reach out to us as well too. I will be sending you a copy of the presentation. I will be sending you a copy of the CPP, as we call it, the Coronavirus Protection Program, and also the one-sheeter as well. For those of you that did have questions, we didn't get to them, I will make sure that Juan and I review them and get back to you appropriately. Juan, thank you. Thank you so much for being with us today. I know you're quite busy educating employers around California. I just wanted to thank everybody again today for coming out and joining us for this presentation. If you have any other questions that are specific to your organization, please reach out to us so we can assist you. Thank you so much for joining us. Thank you, Juan.
Just in closing, I would like to say that please do go to the standards board and open up the standard in totality. You can copy it and print it, or that's very important. And make sure that you look at Assembly Bill 685 and Senate Bill 1159, because right around the corner, come the first of the year, they go into enforcement. Okay.
Sounds great. Thank you, Juan. Have a great day.
Welcome.
Bye-bye.
Thank you. Merry Christmas to all of you.
You too. Bye-bye.